let's do a little case study, and this time we're going to do a little bit of a different case study. So I just had a couple discovery calls from the people that take advantage of free phone calls with me when I put those out there. And I want to share with you one of those phone calls and run it through as a case study, okay? So we're going to say that this physical therapist presents with frustration and confusion. She's been out practicing for 2 to 3 years, started out in ortho, got frustrated, didn't feel like she was confident there, felt like she was like getting kind of like knocked down a peg, and kind of transitioned to doing more ortho specific, so stroke, spinal cord injury, that kind of stuff, and also vestibular. So she came across my content a while ago, started looking at it and wondering, if I implemented these thought processes that Rhett's talking about, would it actually make sense? Would it help me in an ortho setting? So there's her history. So what has she been doing since then? So we're going through the 4 questions that you should ask your patient. So these are the questions that I ask her. So what are you doing now? And she said that she's been implementing some of the, she's been trying to think about law of reciprocal inhibition when she's working with her neuro patients. She's been wondering, and she asked a whole bunch of questions about exercise, prescription, and progression. So we'll get to that in a second. And she's been trying to, it sounds like she's been trying to take out some of the tools in her toolbox that she knows weren't working. Okay. So she's noticing that she's most importantly thinking differently. So she's implementing a different thought process than she was when she was confused and getting knocked down. She's starting to get results where she wasn't seeing results before, but she is feeling like she's plateauing quickly when she starts to see results. Okay. So she's been trying to change her thinking, which she has done a good job of from what she's telling me. She's been trying to do some new things, but she's getting stuck because she doesn't have the tools from the 180 system. So she has some of the thought processes, she's putting that together, but she doesn't actually have the tools to implement, to put those in place of the things that she's taking out of her toolbox. Okay. So sounds like a lot of you that reach out to me, same type stories. I feel like I'm getting better results, not from not doing the bad stuff. I'm trying to implement some of the things that you're talking about, but I don't quite know how to do it. That's why the shift takes 4 months. You're not going to figure this stuff out on your own. Okay. So she had some really good questions about evaluation, like evaluation with more neuro, spinal cord, MS patients. We walked through and talked about how you're not going to get rid of the primary insult. So if you've got somebody with a spinal cord injury and that spinal cord is severed, you are never going to get that to come back no matter what you do with NFTs and palpation. Not going to happen. Okay. But what you can do and what you will do once you figure out how to do this is you are going to clean up these secondary and tertiary inhibitions due to compensation and overuse due to the primary insult. Okay. So if you've got somebody with drop foot and that's not going to come back because they have a cord lesion or something like that, what other muscles do work, aren't affected by the cord lesion? What do work, what can you get to work that are going to have to work overtime for that person to function as best they can with their situation? Those are the muscles you're going to be working on. Those are going to be the muscles that you are programming exercises for. So same thought process applies whether I'm working with a spinal cord injury patient or I'm working with a 14-year-old with an ankle sprain. Okay. I still have to assess function. So I'm still going to run them through the same screen. I still have to get to root cause, and root cause in the spinal cord injury patient's situation is going to be the cord lesion that's not going to come back. Now, what is the compensation? Okay. So we walked through that, made total sense to her. She's like, oh, okay. That kind of makes sense now. then talked about the exercise progression came up. She said, I think I'm giving them the right exercises, but they just get really hard really fast. And I said, because they're fatiguing. And she said, yeah, they fatigue really fast. And I said, okay, so now why are they fatiguing? Did you ever reverse the neuromuscular inhibition? No. Okay, so this goes to the video that is below. So I said to her, did you watch the reel that I posted on Instagram yesterday? And I reposted that video below in the Facebook group where we're talking about verbal cues and trying to make people do things that on a physiological level, they cannot do. You cannot coach somebody into facilitating something that is inhibited. And she said, yeah, that video resonated and made a lot of sense. Okay, so I said, so here's why your exercises aren't working. You never reversed inhibition. If you didn't reverse inhibition, they can only compensate. So now we're talking about a normal patient, or in this case, I was talking about one of her MS patients. So MS patients do fantastic with 180 because we're able to clean things up, get to the root cause, and then give them things to do. Okay. So now her question, so I said, so the problem is you're not reversing the inhibition. You're giving them exercises for the things that you think didn't work. So she said, well, I do the screen and I watch them move and I think I see them do this and that. And I said, okay, now, did you actually prove your work and test muscle by muscle for facilitation versus inhibition? And she's like, no, obviously she hasn't done that. She hasn't been in the shift. Okay, so another thing that you're not going to get over until you get in the shift. So I said, so once you learn how to do that and reverse that, then you're already using the thought processes that you need to use. We're just going to expand those thought processes when we get to exercise progression, and then things will make sense. So then they won't be fatiguing. Okay, so I said, so here's what you're going to do with your MS patient. So if you've got an MS patient that comes in for the first time, let's say it's summer, so they're really run down, they fatigue really fast, they're trying to be active. What you're going to do is tell them, okay, you're going to do this home exercise program 4, maybe 6 times a day, because the whole purpose of the exercise program is to reinforce the facilitation of the muscles that were inhibited. So they need to ramp up and build up capacity and muscle endurance, which is why your patients are failing so fast. They have no facilitation, they have no endurance. So all they can do is compensate, and then once they do that, they fall apart. Okay? So this stuff is clicking with her. I said, okay, so here's the important thing. You understand what I'm talking about. She watched all of the 3-day challenge videos. She understood that, asked fantastic questions related to that stuff. And I said, so you've already figured out that what you were doing was causing your frustration and your confusion because you didn't understand what to look at from a functional point of view, from a physiological point of view. Now you understand what you should be looking at, and you're trying to look at that stuff. You just don't have the tools to use in replace of the tools that you already got rid of. Okay, so this is where, if you haven't been in the shift and you're watching my videos and you're trying to implement this stuff, this is where you're at. You cannot do anything other than fall back on verbal cues, fall back on the eyeball test. So I told her, what you see, what you think you see with a gluteus medius gait, you're probably wrong, or you're probably partially correct. And if you're only partially correct, then you're wrong. You're either all the way correct or you're wrong, okay? The problem is you're using your eyeball test from what you learned in PT school and what you've learned with your experience so far without understanding all of the little inner workings that go behind the scenes because you haven't been in the shift yet. That's why you're having these holes. So hole in the assessment, hole in the evaluation, hole in the treatment, hole in the exercise progression. That's why your patients are getting a little bit better, but they're not getting over the hump. Okay, so that's where the majority of you are. Until you fill in this little hole and that little hole and that little hole, which is not going to be hard once you figure out how to do it, once I help you figure out how to do it. The hard part is when you've been trained a certain way and you only see things a certain way, you can only do things a certain way. So that's why the first module in the shift is the critical thinking module, because until we teach you how to take apart your thinking, put it back together, hold that to a different standard, look at it from different points of view, and then see what the application is, checking your inferences and your assumptions, then you don't have the thought process whole. If you don't have that thought process, you can't do an exam and see what you're supposed to see, another whole. If you don't have that, you can't do the examination. So these holes keep getting bigger, which is why you get to exercise and your patients either don't get any better or they regress. Okay, so a couple take-home points here. Number one, when you have the opportunity to do a discovery call and you have all these questions, do the discovery call. You're not going to figure this stuff out on your own. So in a 20-minute call, I answered a whole bunch of her questions, and every time I answered a question, I could see the light bulb turn on. Oh, that makes sense. Oh, that makes sense. Because I'm giving her information from my point of view and my experience, which is completely different than her point of view and her experience. Okay? So when you have the opportunity to do a discovery call with me, do it. Number two, understand that you only can do what you understand and what you know and what you have experience with. And the only things that you have experience with and understand up till this point is what you were taught in the broken educational model and what you're experiencing in the broken medical model. So you are pretty much handcuffed when it comes to getting over the hump and doing something that's actually going to have a huge impact on your patient's progress and your career. Okay. Number three, keep asking questions, keep moving forward. Understand when you get to those sticking points and you get to those hurdles, the reason why is because you don't have all the stuff that you need. And you can spend years. So a couple of you, if you saw the story that I posted yesterday, somebody texted me or DM'd me and said, thank you for all the information. I've learned so much, yada, yada, yada. You know, I'm starting to get the hang of this and I'm changing my thinking and I'm working really hard on it. He's been following me for over 2 years. So if 2 years ago, he would have said, wow, this sounds really interesting. Start playing around with it. Start seeing that he's able to figure some of this stuff out, but he can't figure all this stuff out. If he would have gotten to the shift 2 years ago, he would be where he wants to be today instead of still trying to dig through all this stuff by yourself. I am here throwing you a life jacket. You're out there struggling. And after you tread water for so long and the seas get rougher, you eventually run out of energy and you can't tread water anymore and you drown. Okay. So instead of spending 2 years driving yourself crazy, getting little bits and pieces and be like, yes, I got it. And then no, I didn't get it. Just join the shift. If he would have done that, he'd be an expert right now. He'd be doing his own thing, whatever he wants to do, getting phenomenal results and not trying to learn things by himself without the knowledge that he needs to learn those things. Okay? Life is hard. Your career is hard, especially when you don't ask for help. So if you have somebody that has the answers and is where you want to be and knows things that you want to know, work with that person. See you later.